Welcome back. Every year, there are tens of thousands of Canadians who have plastic mesh added to their bodies to reinforce weak tissue and help them heal. It's a widely used procedure and it's considered safe. But there are hundreds of thousands of people around the world involved in lawsuits claiming that the mesh has ruined their lives. So our medical specialist Avis Favreau investigates the growing debate over surgical mesh.
Most people undergo surgery to improve a health problem,
Be a good beach day, do you think so?
not to end up in relentless pain and in a wheelchair, like Chrissy Brychek. What was your life like?
Before, my life was great. I mean, I was an active mom. I had my own interior design business. I worked out like crazy. I had a six-pack. I had a great life.
Now she is disabled, weak, and almost once a month she's in an ambulance taken to hospital.
I never know when I'm going to end up in ER. I never know when I'm going to be hit with infection, and I'm debilitated.
After the birth of her youngest, Chrissy started having problems with incontinence, where urine would unexpectedly leak from her bladder. It's a common problem after childbirth. Doctors had a solution: pelvic mesh like this, made of plastic, implanted through her vagina to support her urinary system. She had misgivings after reading about lawsuits filed in the U.S. against some mesh makers, but she says she was assured it was safe.
And I'm like, is this the same stuff that's in the lawsuits? And he said, no, that's completely different stuff. That was taken off the market. That's all been, I use a new type of mesh and you have nothing to worry about. I've never had any issues.
Mesh has been used in surgery since the 1960s, but in the early 2000s, companies began heavily marketing mesh devices, as seen in this promotional video. A faster and easier way to fix two female gynecological problems: incontinence.
The ribbon-like mesh is made from a permanent material that will be well tolerated by your body.
And organ prolapse. That's when a woman's bladder, bowel, or uterus fall, weakened by age or childbirth, with mesh devices designed to hold the organs in place.
The mesh is inserted through small incisions inside the vagina and then weaved through the pelvis, where body tissue quickly grows into the pores of the mesh.
It can be put in less than an hour, usually with minimal training. Patients often go home the same day. And it's easier than the traditional surgery that takes hours and has a long recovery time. But within hours of her mesh procedure in 2013, Chrissy felt what she describes as barbed wire in her abdomen.
So what happened? It got worse?
The pain got worse and worse and worse. And finally, it was like my insides were ripping out. I couldn't pee hardly at all. I had to do acrobats on the toilet in order just to go to the washroom. Just to do a bowel movement was like a big production. I would go back to my surgeon and say, what? No, you just got to keep healing. We're just going to give you antibiotics. And I said, this is not right.
Ever since, she spent long periods in hospital near her home in Windsor, Ontario, where we first met her in 2016. Because the mesh was designed to be permanent, she struggled to find a doctor who would remove it. And even when the implant was out, she continues to suffer from nerve damage and infections that no doctor has been able to cure. She's now on 15 medications a day, painkillers and antibiotics. An IV delivers medication to control nausea, just to help her get through the day.
What do you feel mostly?
Guilt, anger that my life was taken away from me and my kids. I feel neglected by the medical system, that we have to fight so hard to get even an ounce of help. I mourn my past life with my friends, my family, because I know I'm never going to have that again.
The pain is so bad, Chrissy says, she can no longer be intimate with her husband. Her boys, Ben and Jake, understand their mom is disabled.
What does it look like to you about how sick she is?
It's not good because we can never do anything with her because she's always in bed. It sucks.
And what would you like? What would be your wish?
I wish that she could get better and she would never get sick again.
In 2008, the U.S. Food and Drug Administration issued a public health notice that pelvic mesh was linked with rare but serious complications. 2 years later, Health Canada also issued a warning that the mesh could move, could erode into the bladder and vagina, and cause chronic pain and infections, and that doctors must inform patients of adverse events that may occur. But Chrissy, who had the surgery 3 years after the warning, says she was never told and would never have had the implant had she known. She's now suing Johnson & Johnson, the maker of her implant, one of thousands of women in Canada taking legal action, claiming they were injured by mesh.
It's not being reported and it's not being taken seriously. Anyone who has mesh complications, we're kind of swept under the rug.
Around the world, female pelvic mesh is being slammed with questions about safety and reports of complication rates between 2 and 15%. Now, mesh used in an even more common procedure is being blamed for harming patients. Keith Richter was an athletic 22-year-old living in Vineland, Ontario, until he developed a groin hernia. That's when an internal organ bulges through weakened tissue. His doctor repaired it with mesh. Keith says his life has not been the same since.
It's pretty hard to explain some of the pains. Sometimes it feels like it has a heartbeat, and then it goes away. And the next thing you know, I'm fine. And then 15 minutes later, it comes.
And the pain when you get it, how bad is it?
Sometimes it's about a 5 out of 10. Sometimes it's about an 8 out of 10. Sometimes I gotta go, I've been to the hospital twice because of the pain.
How's it affected your life?
It affects my life very much. Like, I can't skateboard, I can't play hockey anymore, I can't kickstart my dirt bike anymore. I just sit on the couch and do nothing.
It makes you really sad.
It's starting to tear up a little bit.
Why?
Because it sucks. 26 years old and I can't do shit. Sorry for the language. It sucks.
What about working?
I go to work about 5 hours a day, but even then it hurts and I have to come home.
Does that make you feel like your job is in jeopardy?
Oh yeah, I feel useless. And I'm not a useless kid. I'm a very hard worker. And now I'm useless. Can't do nothing. It sucks.
Do you believe it's the mesh that's causing your pain?
Well, I never had this pain before, right? Until they did this to me.
He's joined a class action lawsuit against Bard, the maker of his hernia mesh implant. In the meantime, he spends most of his days here, waiting for surgery to remove the device.
What do you want to happen in regards to that mesh?
I want to get it removed. Get back to my normal life.
But many patients say finding a doctor willing to remove mesh is difficult.
There is a small lump right there. Does that hurt?
Yes.
Small-town surgeon John Morrison has found himself in the middle of a big problem. More and more patients, like Kaylee Wiseman. She's flown from Victoria, BC to Chatham, Ontario, desperate to escape her pain.
Now, give me a cough again.
Kaylee is a marathon runner who can't run or even walk very far ever since her hernia mesh surgery nearly a year ago.
Why do you want it out?
Because I have no quality of life with it in right now. My level of pain is, I couldn't continue to live with it the way it is.
It's that bad.
It's that bad, yeah.
How many doctors did you ask take it out?
I went through all of my physicians in Victoria. and no one would recognize that it was even a problem. I contacted all the private clinics around the Lower Mainland. I called 3 of them and none of them would talk to me. They would all do standard mesh repairs, but they wouldn't talk about removal of mesh.
Where are you getting phone calls from?
I've got phone calls from Vancouver to Halifax. I get emails from the United States. I get emails from all over Canada.
What hits you the most about these patients that come to you?
The amount of distress they're in, not just because of the pain, but also because they feel that nobody will listen to them. And that is the most striking feature of all, that they are getting passed from one professional to another to another. And eventually they feel that the pain is in their head rather than in their groin or wherever their pain is. That's called a mesh plug. This goes into the hole, the defect in the tissues, and that reinforces the top of it.
These are samples of mesh used in hernia repairs. Dr. Morrison himself uses some mesh, but he says it isn't often, and he's shocked by what he's seen.
I've seen mesh erode into the adjacent tissues, the tissue that's beside it. I've seen mesh erode into the vas deferens in men, into the spermatic cord. I've had female patients with the mesh erode into the rectum and actually hang out through the anal canal, and the patient come to me thinking they had hemorrhoids. That was from one of these pelvic meshes.
Protesting a questionable medical product.
This mesh needs to be stopped.
As more problems appear.
It's like rebar in concrete.
When W5 continues.
Across Canada, there are people like Chrissy Brychek and Keith Richter who are living in pain after getting mesh implants. And there are patients like them around the world. Here in the UK, mesh-injured women have become enraged activists, protesting in front of Parliament, calling for a ban on mesh products.
Sing the mesh! Sing the mesh! Mesh was coming through my vagina. 4 weeks later, the mesh snapped and caused a lot of damage internally. This mesh needs to be stopped.
We're talking about major traumatic 24/7 pain that goes on and on and on, and they can't sleep and they can't function. They're losing marriages, jobs.
And politicians like Labour MP Owen Smith are demanding an inquiry.
I think there is a significant minority of women, much larger than the doctors have conceded or understood previously, who are over time having really deep life-changing complications, and they need to have their voices heard.
Officials in Scotland have called for a suspension of all female pelvic mesh pending an inquiry. And in Australia, New Zealand, and North America, there are class action lawsuits against some pelvic and hernia mesh makers, alleging the mesh products are a problem. Dr. Vladimir Yakovlev is a pathologist at St. Michael's Hospital in Toronto. He's studied over 500 pieces of mesh after they've been removed from patients.
So you have some samples of mesh.
So this is a fresh sample. This is a piece of mesh from a hernia.
Is it supposed to do that?
No, it's not supposed to be folded like this. It's supposed to be flat. This one folded up. So as a pathologist, I can say that seeing this, I can say that there is a risk or high probability that this will be felt by the patient like a mass, and there is risk for pain, of course. It can damage nearby structures.
And how often do you see the bunched up?
When I receive them, very often. More than half of them come bunched up.
He says that in some, the mesh shrinks up to 50%, with nerves growing through the mesh pores. In some, it becomes very hard. One reason the mesh is difficult to remove.
It's like rebar in concrete, but in some patients it does become painful, in some patients it doesn't. We don't know.
When sliced and under a microscope, he can see mesh fibers, which look like small holes that have poked into an organ.
Mesh eroded through the full thickness of the bladder
His research is also showing some meshes made of polypropylene, a type of plastic, may cause chronic inflammation. He's testified at a number of lawsuits underway.
Does the mesh degrade?
Yes, it does degrade. Becomes more brittle, it cracks, and porous.
Dr. Yakovlev believes we need to learn more about the long-term effects of mesh in the human body.
We probably don't know exact rates of complications at this stage. Some complications occur 4 or 5 years, and sometimes I get a mesh explant 10 years after implantation. So a study needs to follow patients for at least 10 years or so to actually catch that true complication rate.
But in most countries, many mesh products were approved quickly, sometimes with no clinical testing.
If you had to have surgery and they said, we'd like to use mesh, would you?
If they ask me now, would you want to have surgery for your groin hernia with mesh, I would say no. If they ask me for my mother to use mesh for pelvic repair, I would say no.
But other doctors have a different opinion.
Would you have mesh?
I would have mesh, yeah.
Surgeon Colleen McDermott is a specialist in female pelvic disorders based in Toronto. She implants mesh and she removes it when there's a problem. In the right hands, she says, it's a godsend for many women.
What proportion of your patients would be happy with mesh products?
If you come to one of our clinics and talk to most of the patients that I see, they are overjoyed and thrilled with the experience that they've had with mesh fixing their problems. So, and unfortunately there's no media coverage about that, right? Because people who are happy don't usually talk about it.
She believes the problem started when too many doctors without specialized training began using the devices.
I think the companies that were producing these devices were targeting the generalists and inviting them down to do these 3 or 4 day courses somewhere nice and learn how to do them. And then these physicians were going back to their practice and doing a lot of them because, you know, they're quick. It was attractive to physicians to do that, but the problem is that you can't learn how to do these procedures in 4 days.
How long should you be trained to insert mesh in these conditions?
My fellowship was 3 years.
So 4 days versus 3 years?
Yeah.
Has all of this given mesh a bad name?
It certainly has given mesh a bad name, and many of my patients that come in for consultation will say, I don't want the mesh, don't even talk about the mesh, no mesh, and that really puts a barrier when you're talking about treatment plans.
Okay, so these are the 2 components.
The treatment in this Toronto operating room is mesh to repair a hernia. David Urbach is chief of surgery at Women's College Hospital. Despite the lawsuits and the controversy, he says mesh is the standard of care for hernias.
How often do you use it?
In virtually every hernia repair that I do, I would use mesh.
Why?
It's the best method that we have to repair hernias, weighing all the benefits and weighing all the possible risks.
Dr. Urbach says his data shows 1 to 2% of patients may develop problems post-hernia mesh repair. With about 100,000 hernia surgeries performed across Canada each year, most of them using mesh, it will still add up to about 1 to 2,000 people with post-surgical complications.
That may seem like a huge problem, and it is a problem to people who are personally affected, but it's really a consequence of the fact that this is such a common procedure, even if the risk of severe problems is quite low.
So what do we do about that then?
No one's arguing that hernia repair is perfect or that mesh repairs are perfect, but we think on balance that the risks of using mesh repairs are outweighed by the benefits of mesh repairs.
If I was a patient saying, I'm not sure I want mesh.
Yeah.
Very simply.
Yeah, I would say if I was in your shoes and knowing everything I know about hernia repair, I would be totally happy to have a mesh repair of my hernia.
But Dr. John Morrison A surgeon who's been hearing from a growing number of hernia mesh patients in chronic pain says we may have to rethink how often mesh is used.
So you're not against mesh?
No, I am not against mesh. I am against the absolute use of mesh in every case. I would much prefer a surgeon to say, hey, do we actually need to use mesh in this position? Does this patient require mesh?
He'd like more patients to be offered a choice between mesh and older techniques that use the patient's own tissue. Keith Richter wishes he'd been given that option and that he'd been warned about the risks. He's waiting in pain for his hernia mesh to be removed.
What have you learned from all of this?
Ask more questions if you're going in for surgery or something like that. It's like, how many people have came back with this, or like, what's the chances of this working? Is it 99%, 80%? Like, just ask more questions, just instead of just being, okay, yep, just do it.
Chrissy Brychek, who had pelvic mesh implanted 4 years ago, has been in and out of hospital several times since we last spoke to her. She's still in agonizing pain.
I think we need to find something better out there. I think this is hurting too many people.
Well, we asked some of the mesh makers to respond to the concerns about their products, and one of the largest, Ethicon, that's a subsidiary of Johnson & Johnson, replied, stating that the company is confident in the positive impact our pelvic mesh products have had on the vast majority of women. We'll be right back.